Good morning, everyone, and welcome to today's episode of Public Health Spotlight. I'm Mia Collett, one of the business managers at Panoramic Associates for the Health and Social Care Division, and today we are joined by Tim. Tim, could you please start by introducing yourself?
Hello, I'm Tim Allison. I work as Director of Public Health for NHS Highland.
Wonderful. And can you please provide a brief history of your journey to becoming a Director of Public Health?
Thank you. It goes back quite a long way. I started working as a junior doctor, but I realised that I was more interested in the public health aspects of the work. So I trained in public health in the northwest of England and then moved as a consultant to East Yorkshire. And in 2002, with the reorganisation of the NHS, opportunities came up for Director of Public Health, and I moved into Director of Public Health role for two primary care trusts in East Yorkshire, and continued with that. And when they moved to local government, I left East Riding of Yorkshire in 2019, and after about a year or so working in consultancy and doing a few different things, I came back to being a Director of Public Health, and I've been in Highland for just over 4 years now.
Wonderful. And what's it like working as Director of Public Health in NHS Highland?
It's certainly an interesting job. Being a Director of Public Health is varied. I think it's not always exciting. Occasionally it is, but there's certainly an awful lot to do and a whole different, varied lot of interests and activities going on. I've got a great team that are working there, and lots of great people within the organisation and partners, and we've got a whole range of different things, all the way from isolated islands with only a handful of people living there to covering the Faslane Naval Base, we're home of Britain's nuclear deterrent. So there's a wide range and a huge geographical area. People say that Highland, which covers two local authorities of Highland and Argyll and Bute, is about the size of Belgium. But we've only got a population of about 320,000. So there's quite a lot of different and interesting challenges.
Yeah, and can you please elaborate into what is unique about the population in Highland that brings you both challenges and opportunities?
Yes, I think it's largely around the isolation, the distance, and there are a lot of small communities. People don't tend to regard themselves as living in Highland or living in Argyll and Bute. They would see themselves as being in particular communities, whether it's Inverness or Sutherland or Skye or Isla or places like that. So there's a really good community feel, but sometimes it can be quite a challenge to access services. So they may be healthcare services, or it may be individual other issues, even like getting your car serviced, taking a dog to the vet. Those type of things can be quite tricky. Transport is very often difficult. People may have to get a ferry or more than one ferry even to get to the nearest big shop. So we have quite a lot of issues with access and issues with equity, which I think in a rural area, an isolated area, an area with islands is particularly important and challenging to think, how can we make sure that people get a fair access to the services that they need?
Yeah, okay. Thank you. And before becoming a DPH in NHS Highland, the majority of your career was in England. What would you say the main differences are between working in the Scottish to the English public health system?
I think the two particularly strike me. Of course, these days, the English system is based in local government, and whereas the Scottish system is based in the NHS. So wherever public health is based, there tends to be a bit of a concentration on certain issues that are related to that organisation. So with local government, we may be more concerned with leisure, with libraries, with social care, with things that local authorities are concerned with, which may be some of the underlying determinants of health. In the NHS scenario, we're more concerned with system design of healthcare, of patient flows. There are, though, a lot of commonalities between the two, and the basics of public health are pretty much the same. I think Scotland tends to be a bit better resourced when it comes to public health, and maybe has a little bit more national influence than England.
Okay, thank you for that explanation. And the next question is, so NHS Highland is an NHS health board. What is a health board and what does that consist of?
Well, people who are a bit long in the tooth like me may remember the old health authorities in England, and it's something a bit like that, but it's integrated. So the health boards are responsible for providing health care, both in hospital and in the community.
Right.
So there's an element similar to commissioning, where which people in England would be familiar to, but it's essentially providing a service. So we're responsible for community care, responsible for hospitals, responsible for commissioning general practice and other primary care. And within the Highland local authority area, we're also responsible for adult social care, which is an unusual thing within Scotland. So we've got a broad approach, and it's, I suppose, slightly unusual and different, certainly from my point of view, coming from a council in England, and prior to that, a commissioner in England, to be in an organisation that's actually responsible for the delivery of healthcare as well. But it's always good to have something which is a bit different to be involved in, and to try to understand and to take on new challenges.
Definitely keeps you learning, I can imagine.
Yes.
Wonderful. And as a DPH working in that environment, what support do you have, kind of locally, nationally, regionally as well?
Yeah, I mean, I've got the support from my colleagues within NHS Highland. They do good director team, chief executives, work well with non-executives, and a good consultant team. As I said, Scotland tends to be quite well resourced, and also being a provider rather than simply being a commissioner means a wealth of staff. So at the moment there are around 100 or so staff within public health in Highland, which very considerably more to what I had in England. There's a good network of directors of public health, the senior public health staff within Scotland, work from the different boards. Public Health Scotland is supportive, and Scotland tends to be quite a close-knit community. And despite the geographical distances, we're living in Inverness, it's about 100 miles to the next nearest place, whether Aberdeen or Perth. So it's not as if I can just walk around the corner and see people, but we have good level of mutual support, and also I think an increasing recognition of the support available from other parts of the UK and through the Association of Directors of Public Health and other organisations.
Brilliant, thank you. And what would you say your most rewarding part of your career has been so far?
I think I'd say a couple of things. One is to see people who I've worked with before in a junior capacity move on to take up a senior capacity. And I've seen people I've worked with who've been trainees, who've been registrars really, now be directors of public health. So that's, we're meant to be feeling a bit old, but it certainly is very rewarding. But I think the other area is actually to look at the outcomes, the results, to see individuals as part of communities improving their own health. We've got some examples within Highland. We've got also examples which are probably easier to quote because we've got more outcomes from working in England, and to see, for example, people who've been engaged in programs of physical activity and becoming healthier, becoming fitter, losing excess weight, actually transform their lives because of commissioned and organised programs through public health, is really fantastic. I think one thing about public health that struck me over the years is something about delayed gratification or perhaps no gratification at all, because what we do isn't an individual exercise. It's something we all do together, and we can't claim individual credit for that. It's a sort of a mutual credit, and sometimes it takes years or decades to see that. So it can be difficult, but we do see that sometimes, and it's really great when it happens.
Good. Thank you. And what is one skill that you wish you would have developed, or one thing you wish you would have known before becoming a Director of Public Health?
I think it's really about people skills.
Okay.
I think it's even struck me more working in Highland around how what we do working in organisations is very dependent on the types of individuals, people's behaviour, people's attitude to life, people's psychological profile. I've done lots of things like Myers-Briggs in detail over the years, but there's something that goes a bit beyond that, looking at people's motivations and the way people behave, and understanding that more, I think, is very important in terms of understanding how organisations work and how we can actually make change.
Yeah, helps to kind of inspire them as well, I'd imagine. Definitely. And as part of your role, you relocated up to Highland and Inverness. What advice would you give someone who's considering relocating as part of the next step in their career?
It can be a bit tricky. I relocated in the middle of COVID, which added an additional complexity to that, and because of the nature of Highlands, nature of Inverness, particularly, and other places, it's particularly apparent as well. More touristy areas, the property market is very, very difficult. It can be quite hard. But I think as general advice is around looking to develop networks. There are people around. It's asking around beforehand, seeing who's there, who is potentially going to be supportive. I think all areas have that opportunity and of people there who can support, who it's possible to link with, and I think doing a bit of research beforehand and looking at it's probably not going to be as different from where you are at the moment as you might think it is, and some things are maybe quite surprising, but full of opportunities. And I think taking care to look where you go and what particular place you want to end up, and what small area you want to live in, or whatever. I think there are a whole lot of opportunities wherever you go. So I'd say to people, don't get put off by moving, but investigate the possibilities of where you might want you moving to.
Yeah, of course, taking that brave step. And on that topic, actually, what other tips do you have for an aspiring DPH when they're preparing for an interview to become a Director of Public Health?
That's a bit tricky. I'm not sure I'm the best person to be able to answer that question. Okay. I mean, there's something about being being yourself. It's about being able to fit in to the organisation that you're wanting to move into, and recognising that the Director of Public Health role is in many ways quite different from your consultant role. It's more general, it's more strategic, it's an executive role. So the technical skills and technical competences are necessary, but you need to move beyond that to be more strategic, thinking broadly, bringing different ideas together, and using different experiences from across your life and your work history to try and bring those together to generate answers.
I'd say that's great advice. Thank you for that. And the last question is on the future landscape of public health. What comments do you have on what you believe the future landscape of public health will look like or should look like in Scotland and across the UK as well?
I'm certainly optimistic around what will happen in Scotland. There's a determination within different communities and public health organisations within Scotland to make a real difference, to develop a framework of action and activity that will improve health. We need to recognise that there are lots of huge challenges in Scotland which public health needs to address, things like child poverty, drug-related deaths, a lot of the underlying determinants of health. And given that recognition, I think that there is a great deal of opportunity. I think there are big challenges, though, across the whole of the UK. I do worry that the status of public health could be threatened, and how people see the importance of public health activity, directors of public health and their teams. And I think we need to work very hard to demonstrate what public health can do and the outcomes that we can deliver.
Brilliant. Thank you. A very insightful episode. So thank you to everyone for listening. Thank you very much, Tim, for your insights today. And this is today's episode of Public Health Spotlight.